Frontline healthcare workers at St. Luke's continue to work around the clock caring for very sick patients battling COVID in the ICU. This is video recently shot by St. Luke's inside their intensive care units at two different locations.
This is a 39-year-old, intubated, unvaccinated, paralyzed, sedated with COVID-19.
Dr. Jim Souza is the chief physician executive for St. Luke's Health System. He says even if the unvaccinated 39-year-old does survive, he will go back to a much different life.
If this 39-year-old man can survive, that's not going to be waking up, standing up from this bed and walking out. He is going to be terribly disabled by this.
Idaho hospitals have faced significant challenges during the pandemic, most notably in late 2020 when there were serious concerns about the state of the medical system as more and more people needed COVID treatment and ICU beds began to fill up. Frontline healthcare workers say right now it feels worse than the previous pandemic peak.
I actually think now is busier than it was at last year in November, December in time. Seen a lot sicker patients as well too.
Ross Armstrong is a respiratory therapist in the critical care unit. He's worked 15 years at St. Luke's. And like other frontline healthcare workers, Armstrong is frustrated with the current situation as they treat COVID patients with a common denominator.
All the patients we have in COVID here are unvaccinated patients. It's getting to be more frustrating because there's a way to take care of it with getting vaccinated. But there's so much controversy around that for no reason at all. That's what's frustrating about it, is this doesn't need to be happening.
But it is happening, and it is resulting in tragic outcomes every single day.
Unfortunately, too many instances of standing next to families here in the hallway outside the door as they look in through the glass tearfully while their loved one dies. That happened right behind me just last week with a 48-year-old patient while her 4 children stood outside the door and said goodbye.
Dr. William Dittrich is a pulmonary care physician. On top of everything he's dealing with right now, he has concerns about what's coming.
What we're seeing now in our ICUs and our hospitals is people who got infected 2 weeks ago at the fair or at a party or a get-together. There's even more of them out there now than there are here now. And so I'm really worried about what's coming in a week and in 2 weeks. And I'm really worried about what that's going to do to our staff, my friends here, our colleagues, because I already see what it's doing to them now.
Frontline healthcare workers continue to advocate for the safe and effective COVID-19 vaccines as they continue to treat a vast majority of very sick people that are not vaccinated and in grave health.
Really, truly only happening to unvaccinated people. In all the time that I've been taking care of patients here in the last year and a half, I've had one patient that I've taken care of that was vaccinated, and it was someone who had had an organ transplant and was immunosuppressed.
The call from the Idaho medical community to the rest of the state is clear. They ask everyone to do what they can to help the situation, a situation getting worse and worse by the week.
Masking, washing our hands, trying to distance somewhat. I know those things are hard, and I know people just want to go back to normal life and being together and enjoying each other, and I do too. But I want to be able to do that with all the people and not lose any more.